This is Q-Mars. He's a young athlete with chronic back pain. He uses herbal medicines to ease the pain and takes supplements to improve his performance in sports. But after 2 years of using them, doctors told him he's going to lose his femoral head because of herbal medicines and the supplements. But how is that even possible? What do these two have to do with the femoral head? The truth is, some herbal medicines and some fake supplements contain corticosteroids. But why? Why would anyone put corticosteroids into these products in the first place? And if someone does take them, why does it lead to a problem in the femoral head? Why this part of the body? So let's begin with the first question. Why are corticosteroids found in some herbal medicines and fake supplements? Corticosteroids are powerful anti-inflammatory drugs. They are strong, fast-acting, and effective. But they are not without risks. That's why doctors are usually careful with them. They weigh the benefits and side effects before prescribing them to a patient. But here's a problem. In some herbal medicines, especially in countries where regulations aren't very strict, corticosteroids are secretly and illegally added to boost the effects, without telling the person who's taking them. People think they are taking something natural and harmless, and what they are really taking is a drug. In fact, some studies have found that up to 38% of traditional herbal medicines tested contained hidden corticosteroids. In supplements, sometimes, especially in fake ones, they secretly and illegally add corticosteroids to help with better recovery and reduce soreness after exercise. This is done to make the product seem more effective. In fact, some studies show that up to 28% of tested supplements contained hidden drugs, often without any warning on the label. So how are corticosteroids connected to femoral head necrosis? To find out the answer, let's go inside the bone marrow. There are special cells here called stem cells. They can turn into different things: bone cells, cartilage cells, or fat cells. But when corticosteroids are present, they push more of these stem cells to become fat cells. So we end up with more fat cells than normal. And not only that, the fat cells grow larger. As they increase in number and size inside the spaces in the bone, they build up pressure, which slows down blood flow. Over time, parts of the bone stop receiving enough nutrients and oxygen and begin to die. That's how corticosteroids can destroy the femoral head. Now you might wonder, why does this mainly happen in the femoral head and not in other bones? Well, the femoral head has a unique blood supply. It gets most of its blood through tiny vessels that come from just a few small arteries. This makes it more vulnerable. When the pressure builds up inside the bone or blood flow slows down, these tiny vessels can get blocked easily, and the bone tissue can die. That's why the femoral head is one of the most common places where a vascular necrosis happens. So what happens after necrosis begins? Well, it depends on many factors, including genetics. Some people have better blood vessel regeneration or angiogenesis. In those cases, new blood vessels can grow in, and the bone may repair itself, at least partially. But in many cases, especially when the damage is severe, the bone collapses and degenerates. This leads to arthritis in the joint, called secondary osteoarthritis. Eventually, many patients need hip replacement surgery to restore movement and reduce pain. Corticosteroids don't just affect the femoral head. Long-term or high-dose use can have many other effects. They can weaken bones in general, leading to osteoporosis and fractures. They can also raise blood sugar levels, increase the risk of infections, cause weight gain, and even mood changes or sleep problems. That's why doctors carefully weigh the risks and benefits before prescribing them, and monitor patients closely during treatment. But you also need to be careful yourself, especially with herbal medicines and supplements. Always check with a healthcare professional before using them. Don't trust products that don't clearly list their ingredients or come from unreliable sources. And if you've used any herbal medicines or supplements and start feeling pain or discomfort in your hip, don't waste time. See a doctor as soon as possible.